Good afternoon, everyone, and welcome to the Multicultural Media Online Forum, hosted by New South Wales Health, Multicultural Health Communications Service, and Multicultural New South Wales. Today, Minister for Multiculturalism, Natalie Ward, sends her apologies as she will not be able to join us today. But we have a special guest, New South Wales Health Chief Psychiatrist, Dr. Murray Wright, to give us an update in time for World Mental Health Day on the 10th of October. And of course, we have our Deputy Chief Health Officer, Dr. Marianne Gale. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communications Service. We have 30 minutes and we'll keep your questions on the chat and we'll answer them. Please put them through and we'll make sure that we are able to tackle them today. We'd also like to first begin by acknowledging the traditional owners of the land where we're all meeting from today. We pay our respects to elders, past, present, and emerging, and also extend the respect to Aboriginal colleagues. We also take the opportunity to acknowledge the elders from all the multicultural groups represented on this online briefing. For the purpose of this session, Dr. Gale, Dr. Wright, and myself will be taking our masks off for clarity of our message and for those who may be lip reading, for those who have a hearing impairment. And we'll go straight to the questions now and also first get an update from Dr. Gale and Dr. Wright. Dr. Gale, how are you today?
I'm very well, thank you, Jess, and good afternoon, everybody. So we're very pleased to really see our vaccination rates continue to climb. We've now reached 88.6% of people receiving a first dose, a single dose of our over 16s, and 67.7% who are now got a double dose. So that's really terrific. And a big thank you again to everybody in the community for all the efforts over very many months to come forward and get vaccinated, to have that important discussion with your family members and with members of your community about getting vaccinated. It is so important and really great to see such high numbers. And as we've said before, we really think that in New South Wales, we can be global leaders in our vaccination coverage. We think that the vast majority of our population want to get vaccinated, and I do encourage anyone out there who hasn't yet had a first dose of vaccine or hasn't yet booked in for your second vaccine to please do so. And importantly, if you know anyone in your family or anyone amongst your friends who hasn't yet been vaccinated, please do initiate that discussion with them and support them to get vaccinated. Till 8 p.m. last night, we recorded 594 locally acquired cases, and sadly, 10 people passed away. It's encouraging to see the case numbers decline from the peak that we saw a number of weeks ago. However, we must continue to be vigilant, and we know that people are excited about the opening up and the greater freedoms that will be there for fully vaccinated people starting from next week. But it's really important that we all take these next steps very cautiously. It's very important that we don't lose any of the great benefits and the great wins that we have had as a community after all these months of doing it tough, and it has been tough. And so it's really important that we take these next steps cautiously, that we continue to follow the public health advice, the orders which are new and different. And I encourage everybody to look at the website, check the new rules, inform yourselves and those around you of what you can and can't do going forward. Really important to follow that carefully, really important to continue to come forward to be vaccinated, really important to get tested if you have even the mildest of symptoms. Those things are going to be absolutely critical in the months ahead. And we want to all return to as much of a normal life as we possibly can, noting that we're going to live with COVID for years into the future, and things are going to be a bit different. But we recognise that people do want to get back to being with family and friends, but it's very important that we do so safely and cautiously. Thanks, Jess.
Thanks so much, Dr. Gale, and our special guest today, Dr. Murray Wright. Thank you so much for joining us.
Thanks, Jess, and thank you very much for inviting me, and good afternoon, everyone. I'm here because this is the first week of Mental Health Month, and I think it's a really important opportunity for me to talk about what we want to achieve during Mental Health Month. It's generally seen as a time which allows us to reflect on some of the issues which are relating to mental health in ourselves and in our community at large. So in my view, there's never been a more relevant time than right now as we are emerging from a prolonged lockdown to consider what are we going to do about our individual and our community's mental health. During the pandemic, I've been watching closely what's been happening with the messaging and the conversation that's been out there in the general public. And I've been pretty happy with the consistent, clear, constructive, and I think very balanced information about mental health and well-being for the community. And this has been so important because the pandemic, and particularly the restrictions that we've all been under in recent months, has been enormously stressful for everyone. So these messages, I think, bear repetition because even though they're quite straightforward and simple, that they're actually quite difficult to maintain under duress. Firstly, it's about being able to self-monitor in terms of how you're feeling and how you're managing with day-to-day stress, and to have and use effective well-being strategies, which can be different for all people, but they include regular light exercise, having a regular routine, making efforts to ensure continuing social connections in spite of some of the barriers, monitoring sleep, diet, alcohol, and also trying to maintain a present focus. It's amazing. A lot of the anxiety and stress that people experience is reflecting on things that have happened in the past or things that might happen in the future. Staying in the present is a very, very useful way of managing anxiety. But talking openly and honestly about issues relating to mental health has not always been this easy. Until relatively recently, it's been my experience that discussion and acknowledgement of mental illness or vulnerability has often been regarded as a sign of personal weakness and treated with secrecy and shame by people who are suffering and also by their families and their communities. And this, of course, has been hugely destructive to everyone involved. So the narrative that I've been hearing during the course of the pandemic is welcomed. And I've been very encouraged by people's willingness to talk about not just general well-being, but their own struggles and how they're managing. This lifts everybody when that happens. This development is very gratifying, but in my view, we're only partway there. We need the help of the whole community, and especially the media and people who have leadership roles within their communities to continue to demystify what contributes to mental well-being and how to stay well at times of stress, and also how to access advice and support in the event of illness. So I've got a couple of simple messages for Mental Health Month as we begin on what I'm calling the roadmap to recovery. First, the impact on mental health and mental well-being from this pandemic has been significant, and the effects of this can linger for months or even years for people who've been dramatically affected by the pandemic. Next, it's important for all of us to take on board in a very conscious way what you've learned about what keeps you healthy and what your priorities should be, and make them a part of your daily life, even as the world opens up and we all get distracted and busy and, dare I say, excited about our refound freedoms. Thirdly, it's important to look out for others who might be struggling, and there will be people in your vicinity who are struggling. Those people who have experienced loss and have been isolated through disconnection with their families, their communities, and their loved ones. And what you can do is simply talking to them, reaching out and listening to how they're managing and helping them to find a pathway to recovery. Above all, when we talk about the pandemic and when we talk about the way in which we're managing the pandemic, it is so important for all the people around us that we keep the conversation grounded and balanced. In my view, there is nothing impossible or hopeless about this situation. It's difficult and at times it's distressing, but it's manageable. And our discussions should be framed by that sense of hopefulness and optimism. Thank you.
Oh, thank you so much, Dr. Wright. And I think that's so important for us to remember to stay connected. One of the stresses that people experience is also about vaccination and also the restrictions that will be after October 13th. A question here from Violi Calvert from Radio Filipino. What happens and when is the 5-kilometer restriction going to be lifted, and what happens on October 13th?
Thanks very much, Jess. So really from the 11th of October, when the changes come into effect, a new set of rules apply. And for all sorts of things in our life, it's really important to check the advice on the New South Wales Government website if you're not sure about the new rules and what you can and can't do. And the new rules encompass a whole range of different areas, and they include things like where masks are required, what the new rules are around visiting friends and family, what you're allowed to do in someone's household, what you're allowed to do for exercise and recreation, new rules about schools, and a whole range of different things. So all of those changes are coming into effect when we reach the 70% goal, which is from the 11th of October. So I would encourage everybody to have a look at newsouthwales.gov.au to look at the updates on the rules as we go forth that are going to come into effect from when we reach 70%. And then in the second stage, some minor additional changes when we reach that 80% double dose. And then from the 1st of December, where there will be a broader reopening and more things that can be done by both vaccinated, fully vaccinated and those who are not fully vaccinated. So there's quite a lot of change, quite a lot of new different rules. And I'd suggest that the best thing to do would be to have a look at the website and familiarise yourselves with the different new rules that would apply to you and your family and your friends in your particular circumstances.
Thank you so much, Dr. Gale. There's a question here from Pawan Lutra for Dr. Wright. There is a long waiting time to see a professional mental health specialist. As multicultural media, we can help get messages out to the community. Is there an option to have a list made available of mental health professionals from various multicultural backgrounds who may be employed by New South Wales Health, who can access as media for community webinars?
Look, I can answer that question in the general, and that begins with the fact that even people who are concerned about not being able to access a health professional for any kind of a delay, it's important to recognise that there are a number of alternative resources which can assist. So starting with the internet. There are very, very good services which are available through organisations like Beyond Blue, and they have tailored a number of their resources to helping people to address any kind of mental health issues during the course of the pandemic. So Beyond Blue is one. There are also telephone help lines, and we will provide information about those, the actual numbers for services like Lifeline, like Kids Helpline, and also the 1-800 number, which gets through to our mental health services across the state. I would always urge people that if they are experiencing a delay to access services and they're concerned that their condition is changing in a way which they're worried about, is that there are always emergency services available through our emergency departments and through our call centres. So even if you feel like you've been placed on some kind of a wait list, don't hesitate to get further advice if you feel like the situation is deteriorating.
Thank you so much, Dr. Wright. Dr. Gale, there's a question here from Sandeep from Foreign Correspondents Association. Would like to thank the media, multicultural media, who's online today. When restrictions ease for fully vaccinated people, how does the government plan to control the movement of non-vaccinated people, as they could pose serious threat on the community freely moving?
Look, thank you very much. Look, clearly, we are going to all have to learn to live with COVID into the future. And we accept that the vaccination rate in the community cannot be 100%. And there's always going to be some people who remain unvaccinated. And our goal at the moment is to make sure that that group of people is as small as possible. We really want to achieve really high rates of vaccination in our community, because we know that vaccination does help reduce transmission, along with other measures like physical distancing, mask wearing, and our contact tracing efforts. But importantly, vaccination, we know, is very effective, including against the Delta strain, at reducing hospitalisation, ICU admissions and deaths. And it's really important as we go forward and live with COVID that we reduce any impact upon our health system, which is a major risk if our case numbers increase. We really want to reduce the number of people who experience severe disease. So we are all going to live with COVID into the future. We want to minimise the number of people in our community who are unvaccinated. At the current time, we know that there is a significant proportion of our community who can't be vaccinated, and that is children under 12 years old at the current time. And we're hopeful that vaccine options for that younger age group will become available, probably not till early next year. Trials are ongoing, and we hope that there will be safe and effective vaccines available for even younger children. But the reality is that we will live in a society where not everybody is vaccinated, but we all need to continue to go about our business and do it as safely as we can. And that's why into the future, there are going to be certain other restrictions and precautions that we all need to take around capacity limits, size of gatherings, all of those sorts of things. And after the 1st of December, we are going to be freer, but we need to take all of those steps cautiously, because COVID is still going to be with us. It is still a highly transmissible infection. And so we're all going to need to learn to live with this and do so as safely and as cautiously as we can.
Thank you so much, Dr. Gale. Now, Dr. Wright, because of these restrictions that are going to be happening soon, many members of the community are feeling anxious about things opening up, but want to see our family. How can we manage these anxieties?
I think I'm pleased that you've raised this, because I think that it is like a form of recovery as the restrictions get eased and we move back to something approaching our normal lives. It's a bit like if you've been sick in bed for months with some kind of debilitating illness, and during that time you can't wait to get back out into the real world. But as that time approaches and you start on your gentle journey back into the real world after being sick, you can get quite apprehensive about, am I ready for this? Am I going to get sick again? Will I cope? How's it going to work out? And I don't think it's any different in relation to the pandemic. We've been certainly burdened by the restrictions that have occurred, but we've also been reassured that these restrictions are keeping us safe. And that's true. So now we're faced with wanting to reconnect with people, but we have to deal with a level of anxiety about, will I really be safe in doing this? And my view is, as Dr. Gale has said, we need to go gently back into that real world and take baby steps to begin with, to reconnect with people, and to expect that there'll be a level of apprehension as we go and mingle more freely, as we go into potentially places where we would see more people than we're accustomed to seeing at the moment. And by following the guidelines that are being published carefully, they've been put out there because they're considered to be able to keep us safe whilst returning us to normal. But I think that any person who takes their health seriously and is tuned into the issues around the pandemic will have a level of apprehension. That doesn't mean it's a bad thing. It just means you need to take things gently to begin with.
Thank you so much, Dr. Wright. A question from Janie Tham from 2AC Chinese Radio. For those double jabbed in March or April, do they need a booster by the end of this year? Dr. Gale.
Thanks, Jess. Certainly the issue of booster doses is one that I understand is being actively considered by our counterparts in the federal government and by the agencies that have responsibility for looking at the evidence around vaccinations, including around booster doses or a third dose. And we understand that jurisdictions around the world have made some different decisions around that and are at various stages of considering and implementing a booster dose. There is evidence that for some groups of people, that may be effective. So for people who might have a suppressed immune system or a weakened immune system, or potentially for older people as well. So I understand that in Australia, those issues are being actively considered, and we would anticipate that perhaps our colleagues in the federal government will have more news about that in the not too distant future. And once that position is decided upon in Australia and we understand around which vaccines and for which people they could be used as booster doses, then those are recommendations that we would be looking to implement here in New South Wales.
Thank you, Dr. Gale. A question here from our participants. Dr. Wright, what would be your top 3 mental health messages for the cold public, from a multicultural public, from a COVID-19 point of view?
My top 3 messages. Good question. I think because things are changing all the time, probably my top message is make it a topic of conversation, but in a constructive way. And from my perspective, talking about how you're managing and whether you're talking to your friends, your neighbours, within your family or in your broader community. I think that I think it's important to give people the opportunity to talk about what their particular struggles are, what their particular anxieties are, and to share how we're all travelling on this very, very new journey. None of us have been in this situation before. We can't expect anyone to have to be totally confident about the steps that they're taking at all times. And so, as a way of, I guess, sharing our anxieties and our challenges around this, and benefiting from each other's experience, people find that incredibly supportive. Just having that opportunity to not just ask them, how are you going, but how are you managing what's going to be happening in the next few days or the next few weeks? What are your plans? Do you have any concerns? How are you managing that? So I think a practical and focused conversation about how people are navigating this at times challenging landscape, I think, is very, very helpful.
Yeah, Dr. Wright, want to add to that as well, the question of a lot of people from multicultural communities are here and their families are overseas and they can't connect. What should they be thinking about and how do they cope?
I've got a feeling that many of those people could tell me a thing or two about how they've been able to maintain connections through such an extended and difficult time. I certainly know of my own acquaintances who have families of origin overseas, that they've spent many hours trying to connect and bring the family into everyday events. So Zoom dinners. And Zoom coffee meetings and using distance technology just to bring someone into the everyday part of the family. And those experiences, I think, has been really important. I think that, and I know that people are busily starting to think about, well, when the borders open and when we have freer opportunities to travel, how and when are we going to do that? And I think that beginning the process by connecting up more effectively with those people who are perhaps in different parts of the city or in different parts of the state or even interstate begins that process. But I think that some of the things that we've learnt about how to stay connected with people in spite of the barriers to travel are things that will stay with us. And I think that the much more confident use of distance technology, I think, has saved many people over the course of the pandemic. And I can't imagine how many of us would have coped if we didn't have access to that technology. I think it will be used more and more confidently by a wider range of people over the future.
Thank you so much, Dr. Wright. And we have a question here again from Pawan Lutra. Dr. Gale, can you share with us how home quarantine will work in your point of view?
Oh, thanks very much, Jess. Look, my understanding of home quarantine is fairly limited. I have other colleagues who are working on that, and together with the federal government and with other jurisdictions who are looking at similar pilots around home quarantine. I think the broader question is clearly that as we open our borders going forward, and we look forward to welcoming people back to Australia, and we look forward to Australians again having the opportunity to travel overseas, we need to look at sustainable ways of ensuring that all of that can be done safely, and that is also commensurate with any local risk that we have. And clearly now that we have the Delta variant circulating in Sydney and in New South Wales, and as we are moving forward to live with that new reality, the settings that previously applied in the hotel quarantine system that we had that served us very, very well for many, many months since the beginning of the pandemic are no longer really fit for purpose, because we're in a situation now where we have COVID circulating in the community, and that is perhaps not as great as a risk as perhaps people arriving from overseas. So we need to change how we look at the settings, including on how home quarantine might work. And I'm confident that that can be done very safely. And there are a lot of work going into what are the systems to be able to support that to happen safely. But that is a step that we need to take as we move forward into that new reality of learning to live with what we call a COVID endemic environment.
Thanks so much, Dr. Gale. Dr. Wright, the pandemic has impacted the youth from all communities, from culturally and linguistically diverse backgrounds. What kind of support is available for young people and young adults? And also, how can parents support their children or young people to transition back to school, to ordinary life, and help them feel safe?
There's a common thread to a lot of my answers today, because the theme at the heart of it is to talk. And I think particularly in families, and talking about school age and young people who are living at home, I think the issues about how people are impacted by the pandemic and the restrictions, and how they're going to navigate the process going forward, which is not going to be a simple and straightforward task, is that one of the safest things that I would advise families to do is to have a regular conversation, perhaps at the dinner table, about how things are impacting them, and giving the young people an opportunity to speak their mind. It's really important that their anxieties are sought and validated. Every one of us has different fears and anxieties about the road ahead, but we've all got something that we're wondering, how is it going to work out? And I think discussing those and problem solving within the families is enormously supportive, and will help and will help people to feel like there's that they're going to be able to find a way to solve some of the problems they've got. We do have services, and there has been an enhancement of some of the services in the community for adolescents and young people, and that's been out of a recognition that it is particularly young people, and I'm talking about people who are at school or perhaps in tertiary education, who've been severely disrupted through the pandemic, and we've improved the range of services that are available in the community because of that. And so those conversations within the family don't necessarily solve everything, but it's important for everyone within the family to have an awareness of this, and then to talk about, well, what are the solutions that are available to us? And my opinion is that there are many, many solutions out there and services which can help the individual to find their way back into the new normal.
Thank you, Dr. Wright. And you may have seen in the chat that we have our colleagues giving you and providing all the services and lines and links to where you can find translated resources on mental health. And that's available for you on the chat. And if you want, please send us an email and we can find and support you with all those information. So that's it 4:30 already. Time flies, but we'd like to thank New South Wales Health Chief Psychiatrist Dr. Murray Wright for being here, and also to the lead up of World Mental Health Day and for Mental Health Month.
Thank you for having me.
Before we go, any updates or any last words from Dr. Gale? And of course, we'll follow that with Dr. Wright.
Thank you, Jess. No, really just to reiterate what I said earlier, in that I know that this is an exciting period ahead. People are looking forward to the greater freedoms for those who are fully vaccinated, and we're really happy about that for the community to be able to meet with family and friends again. However, it's really important that we do so cautiously. I really urge everybody to familiarise yourself with the new rules and the restrictions that are still there. And as Dr. Wright said, those rules are there to protect us in taking small steps towards living with COVID as safely as we possibly can. So in the weeks ahead, it's really important, while we want everybody to enjoy themselves, but to please be familiar with the rules. Please do so cautiously and safely.
And Dr. Wright, any last parting words?
Thanks, Jess. Look, I think let's use Mental Health Month as an opportunity to make sure that our regular conversations with the people in our lives, whether they're our families, our friends, or our work colleagues, include a conversation about well-being and how you're managing and improving one's health. Thank you.
Thank you so much, Dr. Gale, Dr. Wright, and thank you so much for joining us again here at the Multicultural Media Online. We have some questions that we weren't able to answer, and some people have had raised their hands. So please send us your emails and we'll try to answer them again next week. We want to wish you a good day, and please stay connected, have a good mental health, and also please encourage your friends and family to get vaccinated. Take care.